Hello learners, welcome to this session. I am Dr. Ruchika Kuba, Director School of Health Sciences, Indira Gandhi National Open University, and your course coordinator. Today we shall talk about genetics versus environment in non-communicable diseases. We have with us Dr. Lalit Kumar Gupta, Director, Professor and Head, Department of Pharmacology, Lady Hardinge Medical College, who will be shedding light on this topic. I welcome you, Dr. Lalit, for this session.
Thank you, ma'am.
We have had a few sessions already on non-communicable diseases. Now, what more would you like to talk about today?
Objectives for today's session include description of environmental risk factors for non-communicable diseases, genetic risk factors for non-communicable diseases. Then we will discuss the interplay of genetics and environment, and then we will explain the implications for prevention and management of non-communicable diseases in today's session.
So, just to recapitulate to our learners, we have already learned in our previous sessions that heart diseases, respiratory diseases, diabetes, and cancers are some of the common non-communicable diseases. Although most of these diseases do have some hereditary factors, there are some diseases which are present since birth and are non-communicable. What would you like to tell us more about these risk factors?
Well, a risk factor can be defined as an aspect of personal behavior or lifestyle and environment exposure or a hereditary characteristic that is associated with increase in occurrence of a particular disease, injury or other health condition. So broadly, we can divide risk factors for communicable diseases into two: one, environmental factors, and then genetic factors.
Could you elaborate on some of the environmental risk factors?
Yes. Some of the environmental risk factors include use of tobacco, alcohol use, physical inactivity, common salt intake more than 5 grams per day, low intake of fruits and vegetables, and increased saturated fat consumption, air pollution, which includes both indoor as well as outdoor air pollution, then harmful chemical substances which may be present around our environment, and then in some situations radiations. These are the common environmental risk factors.
We understand and we know, I think now that you have listed, we realize that we know about these risk factors. But why are they important, especially in context with the NCDs or the non-communicable diseases?
Very good question. There have been studies which suggest that environmental risk factors are increasingly being involved in non-communicable diseases. In a recent WHO estimate, it was found that 23% of all deaths are linked to environmental factors. That amounts to 12.6 million deaths per year, which are linked to environmental factors. And it has also been estimated that 2/3 of the NCDs, NCD related deaths, are caused by environmental risks. And it has been found that climate change and pollution are the major threats to human health, with air pollution being the second leading cause of NCDs, non-communicable diseases. And impact of air pollution also can be divided into four major categories, in the sense that about 60% of the patients, they experience ischemic heart disease, those who are impacted by air pollution. Then about 18% are impacted by chronic obstructive pulmonary disease. 18% are impacted by acute lower respiratory infections, and lung cancer in about 6%.
I think these are very alarming figures because we all know that we feel, suffocated and difficulty in breathing when there is an air pollution, but then they actually cause diseases.
Yes,
Something
that is very, very important, and we need to understand that air pollution can be a big killer. On top of that, if there are harmful chemicals and radiations, they may also seep into our air, food and water, and they may cause endocrine disruption, which may affect our metabolism, reproduction, and fetal development. Presence of ionizing radiations in our day-to-day life can result in risk of thyroid and breast cancer.
So the environmental factors are modifiable. We understood that from our previous lessons also, and we can control them. And in turn, we can reduce the incidence of non-communicable diseases to some extent.
Yes, definitely. It is easily said, more easily said than done, but there are some genetic risk factors also. And I would mention that systolic blood pressure more than 140 millimeters of mercury and diastolic more than 90 millimeters of mercury is an important genetic risk factor. Similarly, elevated blood glucose, that is fasting glucose more than 126 milligram per deciliter, overweight and obesity in persons, then raised level of cholesterol, then presence of angiotensin gene is another genetic risk factor. There is a presence of hypercholesterolemia which runs in families. We call it familial hypercholesterolemia, which results in high LDL level and which in turn causes early heart disease. Then some type 1 diabetes mellitus patients, they have HLA-DR3 and DR4, which may increase the risk of development of type 1 diabetes. Then breast cancer and ovarian cancers are associated with BRCA1 and BRCA2 mutations. Colorectal cancer has been associated with APC gene mutation. Then chronic obstructive pulmonary disease alpha 1, which is associated with alpha 1 antitrypsin deficiency.
So, what you mean to say, there are so many types of diseases and conditions that you have said and you have mentioned, and so there are a lot of genetic factors, lot of factors that we get from our parents or in our ancestors, which can also decide upon what type of diseases we are at a high risk. So that means very often we do a lipid profile and we find that our we have a LDL. Now I think everybody knows that we have LDLs and we have cholesterol levels. So sometimes these are high and we get very apprehensive. So as we know that there are some things related to diet, we have also learned that we can control, but there may be some reasons which we can't control and which are beyond our control. So is that what you are trying to tell us, that there are certain genetic things which make us at a higher risk and for which we may be more prone to get particular diseases?
Yes, definitely. That's what we are trying to understand. For example, when we talked about some breast cancer related genes, BRCA1 and BRCA2 gene, and there is also a family history of breast cancer, there are more than around 80% chance of development of cancer in a given individual. You might have heard about one celebrity, Angelina Jolie. She underwent breast cancer surgery or breast removal surgery even before development of cancer, and that is preventive step she took because she had a family history and also the culprit gene which may be present. So that's how we can modify our risk. So that is a possibility. And in addition, there is a possibility of prenatal and early life conditions which may also result in development of increased NCD risk, because these periods are critical periods for development of individual. And if there is disruption in prenatal and early life, there are more chances of non-communicable disease development in a later age. For example, many diseases, chronic diseases like obesity and cardiovascular conditions, they may develop in the adulthood because of these exposures early in life.
So you mean to say that if there is any, we have been hearing that, especially like you have rubella in the early childhood. Of course, it is a communicable disease in the prenatal time. Then you can get malformations. But similarly, probably some brunt of the environmental factors can also have an impact in development of the non-communicable diseases later on in life. So I think that is a very, very important thing. So all females should be very careful when they are pregnant, and what they are exposed to in the environment can modify and can result into diseases which can impact a person even when he goes into adulthood. So we can trace it back to the prenatal period also.
Yes.
Now, we understand that genetic factors can also cause non-communicable diseases, what you have been telling us. But how does this actually happen? Can you explain further?
You may be aware that we inherit several of our characteristics from our parents, for example, hair color, eye color, or even the risk factor for disease itself. So, when this information is carried by genes, not all characters are expressed. Now, presence of environment can result in expression or non-expression of these genes. And that's how we can intervene to some level regarding development of disease. And we call this phenomena as epigenetics. Study of gene expression is known as epigenetics.
That is a very interesting information that you are given. That means even if we have the genes, for example, for increase in the cholesterol or for having blood pressure, but we may not have it. But some environmental factors can influence our genes and can make the gene express. So we will develop certain diseases like higher cholesterol, higher blood pressure. That is a very, very important information, I think, that you are telling us.
Yes. So, environmental factors like diet, stress, and toxins and lifestyle choices can modify gene expression. And these modifications can contribute to onset and progression of many non communicable diseases.
Okay, so now which are the non-communicable diseases which do get influenced by these changes? Are they all, or only selected non-communicable diseases can get affected?
There are more data for some selected conditions. For example, cardiovascular conditions like hypertension and atherosclerosis, they have been found to occur more when they are affected more by these genetic epigenetic influences. Similarly, there are alterations in insulin related genes that can affect glucose metabolism, increasing the chances of diabetes. Similarly, there are some conditions which some changes which contribute to tumor growth and progression of cancer. And it has been found that smoking induces gene expression which results in increased susceptibility to chronic lung diseases, chronic obstructive pulmonary diseases.
Okay. Now, this is a very important thing. Can we prevent the expression of genes? Is there any mechanism, any way that they normally don't express some of them, and because of environmental factors they are expressing? So, what can we do so that we don't have our genes which may not have expressed themselves to express?
Definitely. There are studies which show that we have some epigenetic, like in the previous part, we said that there are epigenetic factors which may be involved in expression of genes. So we have epigenetic biomarkers which we have identified. We have epigenetic drugs also which can affect these changes. So those targets have been identified. But most important is we can simply make lifestyle modifications like diet, physical activity, and stress management. These can positively influence epigenetic markers and potentially reducing the chances of disease risk.
So I think this is a very simple way of doing lifestyle modifications and so reducing the lifestyle diseases. I mean, non-communicable diseases are called lifestyle diseases. So what are the individual initiatives that we should take, or what are the community strategies that can be adopted if we want to manage or prevent these non-communicable diseases?
We have programs for genetic screening which can identify individuals at high risk for non-communicable diseases. We can give tailored lifestyle recommendations based on these genetic position. I will give you a few examples. For example, people with genetic tendency for type 2 diabetes, which is the more common form of diabetes, they may benefit from low carbohydrate diet and high intensity exercises. Once we identify that these are the individuals, these are the genes which he is carrying, we may give it advice regarding exercise and diet, special diet. Similarly, for genetic susceptibility for hypertension, these are the common lifestyle diseases. we may advise the person for low sodium intake and Mediterranean dash diet.
So actually what you are saying is that, these requirements are there for all individuals. That is what, it's not just you have that gene, then you should adopt, a more stringent diet or, a low carbohydrate. That is a general lifestyle, but you have to be more careful if you have those particular genes which can be expressed.
Right, right. That's what, if those genes are there, and if we are able to identify those genes, and if we are able to intervene in those individuals, chances of disease development will be considerably less in those individuals. Of course, they are going to benefit all the population.
Yes.
Yes.
So, what are the public health measures we've talked about at the individual level, but as a community as a whole, or as a public health policy, or public health, strategies that can be adopted? Can they also be there for reducing the non-communicable diseases?
Yes. It makes sense that we reduce air pollution, because many studies have shown that reduction in air pollution can result in lower incidence of asthma, chronic obstructive pulmonary disease, and also cardiovascular diseases. We may encourage healthy eating campaigns. For example, some countries which have policies for reducing trans fats have considerably reduced the chances of development of cardiac diseases. And some countries also have sugar taxes. They help prevent obesity and diabetes. All these are aimed to intervene at a community level. Similarly, we may encourage physical activity by designing walkable cities, and we may encourage workplace wellness programs, inclusion of gyms in at the workplace, and this may combat to some extent the sedentary lifestyle.
So, thank you very much, Dr. Lalit. Today's session has been most illuminating about not only the influence of environmental factors, but also how these factors can impact the genetic expression, which is a very important concept, I think, new thing which I don't think our course learners would be knowing, and these can increase the chances of NCDs. You have also given us very important tips on how we can reduce our chances of NCDs by modifying the environmental factors and controlling them so that the gene expressions don't take place. Now, in the end, what message would you like to give to our learners?
I would say that it is critical for understanding the interrelationship between the environment and genetics, for increasing the chances of genetics, which increase the chance of development of non-communicable diseases, so that we can formulate effective interventions. We need to have more research and practice based on the interaction between uh, genetic and environment risk factors for development of non-communicable diseases. Then we need to explore novel avenues in gene-environment interactions and role of social determinants in health, which can inform us for future public health strategies.
Thank you so much, Dr. Lalit. I think our learners should have become wiser now, especially how they can, at an individual level, take this message and this campaign forward, and how, and there, whether they are in the workplace, whether they are at a managerial level, whether they are at a policy decision level, they can also influence the public health strategies which can be taken forward for managing the NCDs related to environment versus genetics.
Our NCDs are going to be our next big killers in our in the coming decades. NCDs are going to be as problematic as the infectious diseases, and we need to intervene at various levels, whatever possible levels, to reduce their impact.
Thank you.
Thank
Thank
you.
you so much.